our scientist panelists.
Recording in progress.
Officially open this media briefing. Good morning, ladies and gentlemen. My name is Foster Mohale. I'm responsible for media relations in the National Department of Health. Without wasting any time, I'm going to declare this media briefing officially opened, and I'm going to start by introducing the lineup of the day. As usual, Honorable Minister, colleagues, are going to get the opening remarks and message of the day from the Honorable Minister of Health, Dr. Joe Phaahla. He'll be followed by Dr. Michelle Kurum from NICD, who's going to give us the observations as far as Omicron variant and the fourth wave is concerned. She will be followed by Dr. Matebula from the CEO of Steve Biko Academic Hospital, who's going to give us the clinical experience and observations as far as dealing with this variant is concerned. She'll also share with us her personal experience of dealing with this variant. She will be followed by Prof. Glenda Gray, who's the president of MRC, who will be accompanied by Prof. Alex Segal, who are going to give us the presentation as far as effectiveness of our vaccine are concerned. Then we'll be having the media interaction session, followed by closing remarks by the Honorable Deputy Minister, Dr. Sibongiseni Dhlomo. Without wasting any time, I'm going to hand over to the Honorable Minister, Dr. Joe Phaahla. Over to you, Minister.
Thank you very much. Thanks, Foster, always very capable in setting up and coordinating this press briefing. And greetings to Deputy Minister Dhlomo and to the DG, Dr. Crisp, and all the panelists, Prof. Glenda and the rest of the team, NICD. Welcome to Dr. Matebula, CEO of Steve Biko. We're happy to see you. You'll also tell us as Foster has said, your personal experience with, I don't know whether just to say COVID or Omicron. Ladies and gentlemen, we are back to keep you updated on developments in as far as the COVID-19 pandemic in the country and how we managing in containing this invisible enemy. Now, we know that a few weeks ago, exactly on the 25th of November, together with Professor Tulio de Oliveira and other of his colleagues, we made the announcement about the new variant, the B1.1.529 as it was then, which was subsequently at that time having been discovered in South Africa and Botswana and Hong Kong. But subsequently on the 26th of November, it was given the name of Omicron by the WHO. As of 2 days ago, 42 countries in all the 6 WHO regions had reported this variant. But yesterday, the Director General, Dr. Tedros, reported even more countries, that 57 countries had reported this variant. Now, Omicron has driven the resurgence of COVID-19 cases in South Africa, with currently just over 90,000 cases reported nationally from the 7th of November to 4th of December 2021. Weekly cases in Gauteng province have increased by more than 400% for the week of 4 December 2021 compared to the previous week. So a very significant increase just in that week, while hospital admissions increased by more than 200%. Now, the recent genomic sequencing by our network of genomic sequencing teams revealed that Omicron was the dominant variant amongst samples sequenced during November 2021. Up to 70% of those specimens showed Omicron. That is, as far as of yesterday, 70% of the tests done were showing Omicron as the dominant variant. Omicron is most likely the variant driving the increase in cases in Gauteng province over the last 3 weeks. This variant of concern as we've said, as the scientists reported, has multiple mutations that may have an impact on how it behaves. The scientists have been conducting rapid research to better understand many aspects of the Omicron variant, including how well this variant transmits and whether it can escape some of our immunity. And we'll share their findings on these studies as more and more results become available. But what is known currently in terms of transmissibility, well, it's not yet fully very clear, but it seems likely that it is more transmissible, just looking at the way in which it has spread over a very quick period with a very steep graph of the spread of the infections over the last 15 to 20 days. As if you compare that to how the previous variants, such as the one which which it is just replacing now, the Delta variant. So we can see a significant difference in the graph of how Delta spread and how Omicron is spreading. Omicron very quickly has displaced Delta, is quickly, quite seriously displacing the Delta variant. In Gauteng, almost displaced it. The number of people testing positive has risen in Gauteng, and this variant, the Omicron, has also spread by now to all the provinces. Now, what also shows that it is highly transmissible is that the reproductive number of the virus, which shows how many people are likely to be infected by one person, is currently 2.5, which is higher than it was at any prior point in the pandemic. So whether we speak about the Alpha, the Beta, the Delta, none of them had even reached anywhere close to 2 in terms of the reproductive rate. Now the Omicron has passed 2 and is now at 2.5. The severity, in terms of the severity of disease, this one is also not yet clear with the Omicron, whether it causes more severe disease or if it leads to even people admitted to ICU and death, as if you compare it with the previous variants, especially the most recent one, which is the Delta. So this information is not yet clear, but preliminary data does suggest that while there is increasing rates of hospitalization, which may be largely due to overall big numbers of infections. And Dr. Matebula will speak to this, and also our colleagues from the Dr. Jassad from the NICD will also speak to this. But it looks more like that it is purely because of the numbers rather than as a result of any severity of the variant itself, of this Omicron. Early data from DATCOV, which is monitoring our hospital admission, the hospital surveillance, shows that among patients who already had a hospital outcome and were no longer in hospital, a lower proportion of patients admitted in the fourth wave, currently, this is the fourth wave, had severe disease as compared to patients admitted in a similar time frame in the second and third waves. So in this case, severity is defined as any patient who developed acute respiratory distress syndrome, patient who received oxygen, who had to be ventilated, or was treated in high care or succumbed to the virus. Similar experiences have been reported both from the public and private hospitals in Gauteng. It must be noted that severity data has several limitations at the earliest phase of a wave when the numbers are small. Patients with mild symptoms are more likely to be admitted as a precaution in the early days. Patients are diagnosed with COVID-19 incidentally when admitted for other reasons. I think we heard this also from the CEO of Netcare, that was their experience. And because there has not been sufficient follow-up time for severity and outcomes to have accumulated, which is typically up to 3 weeks after diagnosis. So this is still early days, but there are very promising signs that largely patients, even those who are in hospital, are mild. Many of them are incidental. They came into hospital for other reasons, other illnesses. And because when you have to be admitted, you have to be tested first. And many of those who had come for other reasons have tested positive, notwithstanding that they are not ill from the COVID-19 variant itself. Understanding the level of severity of Omicron variant will take some weeks. Our hospital surveillance has demonstrated that patients still do experience the full spectrum of the disease, from mild to severe, the extent of which, in terms of number of patients, this is still to be determined. All variants of COVID-19, including Delta variant, that is still currently dominant in most parts of the world, can cause severe disease or death, especially for the most vulnerable people, those who are older and also with underlying medical conditions. And that's prevention, as we always emphasize, is the key, rather than waiting until you get infected. In terms of the symptoms, we have from reports from various doctors, we don't have any information that suggests that this variant causes different symptoms from other variants. Anecdotal information from doctors have reported that patients present with scratchy throat, cough, fever, diarrhea, and vomiting. In children, many have no respiratory symptoms. So children often test positive without any respiratory symptoms. In terms of whether prior infection protects you, preliminary evidence suggests that there may be an increased risk of reinfection with this variant. People who have had previous COVID could become infected more easily with this variant as compared to the previous variants of concern. A preprint, not yet peer-reviewed article has been published on the risk of reinfection in South Africa, reporting a 2 to 3 times increase of reinfection. Reinfection is defined as positive test after 90 days have passed from the previous infection. But more information is required and will become available in the next days and weeks in terms of the significance of these reports. In terms of the vaccines, I know many people have been concerned, and also in the world. Our scientists are also still conducting more studies to understand the potential impact of this variant in as far as how it behaves towards the vaccination. And this will also take some time. But current vaccines have shown to be effective, even as this wave has been spreading, because the significant number of almost, in many reports we have received, suggests that 70% of those who have been admitted to hospital are those who are unvaccinated. So as things stand, the vaccines are showing to be really still very strong in protecting against severe disease. As it has been with the previous variants, it shows what the figures from the numbers from hospitals does show that indeed those who are vaccinated are much better protected even against this. So there are some indications that some of this, there might be some weaknesses in as far as some of the vaccines. Some of the reports indicated there might be some weaknesses on the Pfizer, but again, this is very early. But overall, what we are seeing is that the protection is still very strong, even on this variant, as I've said. At least those who have been admitted to hospital, it shows up to 70% being those who have not been vaccinated. The PCR tests are still very effective. Also in terms of the rapid antigen test, also shown to be very effective in picking up this variant as well. Current treatments are also still very relevant: steroids, corticosteroids, oxygen therapy, antivirals, anticoagulants, all this which have been used over the last 20 months or more have shown to be very effective. The issue of infection of children, let me just touch on that. During the 3-week period from 14 November to 4 December, there has been an increase in admission of children under 5 years. This has been observed in the Tshwane Metro hospitals, where the early resurgence has occurred. Children 18 years and younger comprised 21% of admissions during the early period. However, this pattern has changed over the subsequent time from the early days, and the proportion of admissions in children less than 5 years in total admissions has decreased to 14%. It was 21, then 14% in week 46, and currently it's even lower at 8%. So this seemed to have been the phenomenon early, but it has now changed to more adults getting infected. The provincial and national picture is indicating an increase in both cases and admissions amongst children of all age groups, but no change in the proportion of children getting seriously ill or dying. Early data from hospital surveillance also reports from public and private hospitals indicate that admissions are largely in children admitted for other reasons and then testing positive, and for very short durations. So despite making up 30% of the population, the younger people comprise only 12% of cases and 5% of hospital admissions. However, the children who are at risk of severe disease are those under 1 year, and people with other comorbidities. For children who are premature and who have diabetes, cancer, and also those with HIV and TB. It is not yet clear what is driving the apparent increase in children, but I'm sure some of the panelists will also comment about this. But what we want to say is that there is really no need for alarm. We expect this variant to behave the same way as the previous variants. As we've said, other aspects of transmissibility is showing, but in terms of severity of illness, there are signs that actually they might be less severe, and other panelists will comment further in terms of this. We know that the vaccines, as I've emphasized, it remains the bulwark of our protection against all these variants. Now, in terms of how we progressed in terms of this, as of yesterday, the 9th of December, we are just short of 27 million doses. I think by today, early today, probably already by now, we must have crossed the 27 million doses administered. We have passed the 43% of adults covered, although this varies from province to province. Provinces such as KwaZulu-Natal and Mpumalanga are still low at 37%, while Free State and the Western Cape province have already surpassed 51%. We're still doing better with the over 60s at 65% plus, and the over 50s having passed 60%. The 35 to 49 still just over 45, I think about 48% now. The major struggle which we're having is still with the younger people 18 to 35 years of age, which is still below 30%. So we really would like to urge everyone to work with us to motivate the younger people. The reason why our vaccination rate has dropped from the highs of 290,000 per week to just around 150, 160, 290 per day, to about 150, 160, sometimes even 140 to 130 in a day, is largely because while there's been good coverage of the over 60s and over 50s, the young adults are not coming up in good numbers. And we would want to urge them not to listen to what they read on social media, all the anti-vax stories. Protect yourselves by coming forward and taking the vaccine. Now, I want to again repeat that this is really the best protection for us going forward. So what we'll be doing in the next few weeks, the scientists will continue, as they've done in the past, to conduct quality research to understand this variant and share the information as quickly as possible. Our scientific advisors continue to provide our government the guidance on what kind of restrictions we need to, if we have to impose further restrictions, the expansion of vaccination, and also introduction of new treatments. Government will work hard with our provinces to make sure that our health facilities are ready for any eventuality, making sure that our search plans are ready. We will make decisions about what further restrictions based on this advice from our scientists. As I conclude, first up, I want to again just say that this is the time that while there might be a lot of concern, there should be no panic. Even this variant, as far as we can see over the 2 weeks or so, can be under control, working together. We can reduce transmission, even though it does look highly transmissible. We can work together to reduce those who fall seriously ill by making sure that more people are vaccinated. So it is important that we must continue to use all the non-pharmaceutical protective measures, which we all know, wearing masks which are well-fitting, good ventilation, avoid crowded places, which are poorly ventilated, washing hands, sanitizing, and all the other measures. So as we conclude and wish everybody a very good festive season, we can have a good festive season if more people vaccinate and if you all keep safe. Thank you very much.
Thank you, Honorable Minister. Indeed, it's our collective responsibility as individuals, families, employers, communities, the province and the country to have a great Christmas or festive season this year. Without wasting any time, I'm going to call upon Dr. Michelle Group.